So thank you to UHealth Jackson Children's Care for bringing our expert in today, Rosia Garcia. Thank you so much for joining us, Rosia.
Thank you so much for inviting me.
We are so happy that you're here. And I want to tell our audience a little bit about you. She is a pediatric dietitian at UHealth Jackson Children's Care, and she graduated from FIU. And she began her career as a nutritionist at Jackson Memorial in 2008. At first, she was working with adults, but then decided to change her path and focus on children in 2018. So she's currently in pediatrics and specifically in intestinal rehab and the transplant program, which is so fascinating. And so, working with so many children that have eating difficulties, not only due to their medical conditions, but also aversions to solids or certain foods, it's really forced her to learn and understand the what, the how, the when of introducing foods so that she can help parents. So, if you're a mama listening today, or a dad, or a caregiver, you are really in for a treat because Rosia is going to just share so much wisdom with us. She understands exactly how difficult mealtime can be and how much stress it can cause at the table. But thanks to her advice today, and we're going to work hand in hand. And she also works with speech and language specialists. So she has helped so many families. And I'm just thankful for the ways that she is going to help us today. So, Rosia, thank you, thank you, thank you for joining us. We're so excited. We've got a huge audience. I think everyone can identify with this struggle. We've all had a picky eater at one time or another. But you're going to give us some hope today. So thank you for joining us.
Of course, thank you for having me.
Of course. Well, we are so excited to get started. I have a few questions. Again, if you have a specific question, drop that in our Q&A feature. I'd say get those questions rolling early because we are going to hard stop right at one. So if you have a question, get it going so I can get it out to our expert. But let's start just generally. What makes a child a picky eater? I mean, they're all born. They all have taste buds. Why do some like this and some not like this? What makes a picky eater?
Well, there's many factors, and a lot of times it could just be part of normal development, right? As they start experimenting with different textures, you just like us, there's going to be some textures that we like and some textures that we dislike or we're not like fan of.
Mhm.
So, but there's also other factors like there could be like genetic factors, um, for certain predisposition to liking certain foods versus other foods, right? There's also like sensory that I was saying before, like the textures, right? Liking some versus others. There's also like early feeding difficulties, like if the child is having feeding difficulties early on for
Okay.
different things, like sometimes surgeries, and they prolong the feeding, right, of the baby. That
Hmm.
could also contribute to having more food aversions and feeding difficulties later on, because that
Okay.
suck and swallow that we first experience when we're first born and we are either
Yeah.
given a bottle or latched to the breast
Uh-huh.
will affect how we do it, or how the baby does it later on.
Wow. Wow.
So
I never thought the correlation between like immediately and then later with food. I just kind of think, nursing
yeah,
or not, or milk. So interesting. Wow.
yeah,
Okay. Well, talk to us about, we're going to get into the nitty gritty too. I love seeing that there are people joining us from all over Mexico, Orlando, Miami Beach, Pompano, Michigan. Michigan, hello from the snow. So wonderful. If you've got your questions, put those in our Q&A. Let's talk about what should a kid's plate look like? Is there kind of a template for how that we should make a kid's plate look when they're
yeah. So
being
the
exposed?
USDA has a plate model that shows us how to set up the plate for the child, right? We normally like half of it with some veggies, obviously portion it according to your child's age,
Hmm.
right? So a few pieces and then some protein and then some carbs. So we
Yeah.
want to include the three major food groups,
Hmm.
but it also, like with the veggies, could be some fruit as well, right? Mixed it
Okay.
in.
Yeah.
Uh,
Fruits and veggies.
but again, the portions would entail would be based on the child's age,
Okay.
and then also not overwhelming the child with like a large portion of foods that maybe are new, right?
Right.
If we are introducing a new food, it's important to introduce like a small piece of that food
Yeah.
next to the foods that the child is used to and that likes.
Right. Okay. I think that's a mistake I know I always made as a mom is I just plop it on there and I'm like, if they'll just eat one little bite, one little taste, like where's progress? To
Yeah.
rejoice in the little progress. Yeah.
Exactly. So introducing it in small amounts so that it's not overwhelming. And obviously, like introducing it and not pay attention to it, to whether
Yeah.
the child eats it, tastes it.
Good.
Because a lot
Okay.
of times they won't eat it at first. They'll
Yeah.
just like touch it, smell it, play with it, and that's okay.
Yeah. That's good. That's good. I think I grew up in the generation of like the clean Play-Doh, and it's like we can easily transfer that to our kids of like, you should eat all of everything on your plate, but not necessarily,
Yeah.
That's
Yeah.
good. Talk to us about the foundational blocks for making a kid not picky. Are there any things that we can do to help them not be picky?
So the number one factor, I think, is the stress around the mealtime.
Mm,
Right? We put a lot of stress on ourselves because we believe that we're better parents if our child eats perfectly, like
yeah.
fruits, veggies, and protein. And it's okay if it's not perfect, right? Being okay with the imperfection, if we want to call it that, or
Yeah.
like the failing of our
Yeah.
child not eating a certain food,
Yeah.
because it's not failure, it's just part of their development.
That's
So
right.
another thing that can help is also like family meal time, right? Sitting all together at the table and them seeing us eat that food as well, but
Hmm.
always without pressure and making food fun. I think we put too much stress on food, like getting them involved in food preparation, meal planning. Like we can get them involved in saying like, hey, what do you like? Let's plan tomorrow's dinner. What would you like to have? And get them involved and also in preparation, right? Because they're more willing to try that food if they helped prepare it.
Yeah, that's great. Involving them. I always do feel like my children are way more apt to try something new if they had some sort of job in the process of seeing it all come
Yeah.
together. So, okay, that's good. That's encouraging. You talked about texture and how that can be one of the things that, can play into picky eating. So, yeah, what role does texture play in picky eating?
It's actually a major factor, right? Because certain foods that are, let's say, gooey or too crunchy for certain kids could be a major trigger for not wanting to touch it or taste it. So it is important to just work with like not work with them necessarily, but actually exposing them and letting them decide when they want to try it.
Hmm.
So you just expose them to the food, let them play with it, let them smell it, let them maybe bring it to their mouth, but maybe they won't bring it to their mouth for maybe after the third time that you are exposing them to that food. It's
Hmm.
okay. Sometimes the color can also be a turn off for some kids, right? They may not like the greens.
That's right. That's right. That's
So it
right.
is just
Okay.
exposure, basically.
Exposure. Just keep it. I
Adaptation.
remember, is there like a statistic on that, like 15 or 20? I feel like I've heard something that was way more than I thought. I thought, oh, I got to keep introducing the carrots, don't give up on the carrots.
Don't give up. Yeah, exactly. So it depends because every child is different.
That's
So
right.
some children or some kids are more open to exploring versus other kids that are more reserved and they're like they want to stay with their safe foods.
That's right.
So for some kids it may take 10, 15 times. For other kids it may take 3 or 4 times. Just
Right.
depends.
Okay. Here's a great question from our audience, I think, so that we can all identify with. But she says her son, who is 4 years old, used to eat a lot of veggies, but now it's impossible to get him to eat vegetables. What is a good suggestion?
It's again serving it but without pressure or actually allowing them. Sometimes it's also good to do like a family style service.
Okay.
So you actually allow them to choose how much of the food they want on their plate.
That's
So
good. Yeah.
they may be more willing to try that because they're choosing how many, let's say, green beans they want on their plate.
Uh-huh.
And then allowing them to eat whenever they want to eat it. Because if we
That's good.
put the pressure on them of like, you need to eat vegetables, you need to eat these greens, you need to, that is actually conducive to them rejecting it, right?
Yeah. Interesting. Yeah, I never thought about, I mean, I always serve up everyone's plate because I think you all need to try a little something. But that's great, giving them a little bit of the power and the ownership and the responsibility, and it feels empowering, I'm sure, for them too. That's good.
Exactly.
Great question from our audience. Thank you. Did you want to add something? I'm sorry, I interrupted you.
No, no, it's us again removing the pressure from the child.
Mhm,
or
mhm.
the pressure around meal times, because then we cause them to be anxious around the mealtime because they know that, oh, they're going to push me to eat these foods or these veggies or these fruits or whatever it is. So that's actually creating anxiety, and that is
Mm,
going to be conducive to something, worse later, right? When
that's
they're
right.
really, yeah. As they grow,
Yeah,
they're also going to go, as they develop, they have different stages of development. So their needs are going to change, their wants are going to change, but it's all part of life. Doesn't mean that because they're not
that's
eating
right.
veggies now, they're not going to eat veggies later.
That's true. That's true. I must confess, I didn't start liking tomatoes until I was in my 20s. I'm embarrassed to say. But people come around. So I have to
Yeah,
remind myself that with my children.
exactly. Your taste buds
Oh,
are going to change as you develop and you grow. And some
that's
things that
right.
you thought, like I used to not like beets, but it was more
Yeah.
like a thing with the color, I think.
Right,
I
right. It's
wouldn't even touch it. And now I love beets. So
Yeah, it's so interesting. Patience, patience, mamas, we can do it. Daddies, yeah. Okay, so we talked about introducing. Are there certain ways of like how and when to introduce different textures? Should you do that from the get-go? I have a little 7-month-old. Should I be introducing lots of different textures, obviously in a safe way, but kind of when should you introduce different textures?
well, it depends on what you want to do. If you want to do more the baby-led weaning, where you're introducing solids pretty early on, right? And letting them like actually taste or grab different foods and just like they kind of like feed themselves, right? With a baby
Mhm,
led weaning, you're
mhm.
not feeding them.
Right.
It's basically them feeding themselves versus doing the soft purees and then moving on to maybe like mashed with some texture to chopped, soft
Mhm.
chopped in small pieces. So that would be like the normal, not the normal, but like the most conservative way, right, of
Uh-huh.
introducing
Uh-huh.
foods or solids to babies. But now there's like it's been shown that also with baby-led weaning, there's less feeding aversions because they're introduced to different sectors very early on.
Yeah. Yeah. Okay. That's great. That's great. All right. What if you yourself are a picky eater? Will that make your child a picky eater? And if so, how can you prevent that?
Actually, it can because
Mm.
there's a genetic factor
Wow.
in
Okay.
picky eating.
Interesting.
Yes, usually children from picky eaters will more likely than others be picky eaters themselves.
Interesting. Okay.
Yeah. So, but I think it's just exposure and introduction to different foods. But remember that your children are also going to be more willing to try foods that they see you eating, right?
Right.
So
That's
if
right.
we're not eating green beans, we can expect our child to like green beans. I mean, they may like green beans because they tasted at a friend's house or in school, but
Right.
mostly, it's what we also expose them to at home.
That's right. That's right. Yeah, more is caught than taught. This is what you
Yeah,
hear. That's good.
exactly.
Okay. All right. So how can we get our children to eat a wider variety of foods? First thought, I'm like, well, we just offer them or they see us eating them, but elaborate on that of how can we help our kids eat more of a variety?
By exposure, is exposing them and serving them. But remember, when you're serving, like I said before, when you're serving a new food, it has to be a small amount. So
Mm-hmm.
it's not overwhelming. So
Mm-hmm.
it's trying different foods and introducing them to different foods.
Yep.
Um, and just exposure, let them explore.
Yeah, that's good. Okay, here's a question that I just saw in our chat, and it's helpful. Yes, if y'all put your questions in the Q&A so I don't miss any, but I caught this one that says, is it better to introduce one food at a time and focus like on just that food for, 5 to 10 days is what she says until they accept it? Or is it better to do several at once, but always putting like a safe food on the plate? Like I know they like, carrots or whatever, but how should they do that? Should you zone in on one or introduce several at a time? What's your take on that?
Well, it depends on the child and how accepting they are of new foods. Um, Definitely putting always a safe food on the plate when you're introducing a new food, always something that they already like. Um, and then it would depend on the child of if you see that your child is more open to trying new things, that he may be or she may be a candidate, if you want to call it that, uh, to be introduced to different foods more often
Uh-huh.
versus someone that is more picky and it's going to take them a little longer to accept the
Longer.
food. Maybe you want to work with one food at a time to try to avoid the pressure of like all these different foods.
Yeah, that's
Very
good.
cool.
Oh, Rosia, I think that's a great word for parenting in general too. And we kind of keep coming back to this. It's like every child is different. Every child is different. So often the temptation, I think personally, in motherhood is like, what's the right way to do this? And at what
Or
point should they be eating the colors of the rainbow? But that every child is different. And if we can just alleviate some of that pressure, we're going to see probably more success quicker. That's encouraging.
yes, and I think also exactly on that to elaborate on that, like what I encountered also is like sometimes parents say like, "Oh, but my first one ate everything I put on the plate, and now I'm suffering with this one." And they want to do whatever they did with the first one because it worked with the first one, but it's
Mhm.
not working with the second one, right?
Yeah, that's
And
right.
it's
That's right.
because yeah, we're all different.
Yeah. That's good. That's good. Okay. Well, one parent says, can I consider my daughter as a picky eater if she eats small amounts, even when she eats almost everything? She's noticed that she eats more from time to time, but not always. So she's eating just smaller amounts. Is that considered a picky eater?
So the picky eater would be more a child that is not willing to accept different food groups and is stuck on like certain food groups, right?
Yeah.
That
Yeah.
would be more of a picky eater where they're not accepting
Hmm.
anything but um a certain food.
Yeah. That's good. Okay, you were mentioning about safe foods a minute ago, and one parent says that, oh, it happens to me sometimes if I include a safe food, they just only eat the safe food, like, and they just keep the new ones aside. But you would say just keep reintroducing, right? Just keep,
Yes, it's exposure.
yeah, that's good. That's good. All right, here's a great question. How can you increase appetite in an underweight child? Is there any natural appetite stimulant for kids that you would suggest?
I mean, the B complex vitamins usually
Okay.
stimulate appetite.
Okay.
So if you want to go the natural way because you feel like your child, I mean, not you feel that your child is underweight, you've been, in that sense, I would recommend that you discuss with a pediatrician where the child is in the growth chart.
Mm-hmm.
Because as long as what we're discussing earlier, as long as they're growing on their growth chart, right? Not every kid has to be in the 50th percentile. Maybe they're on the 5th or the 10th percentile, so they're on the smaller side, but they're
That's right.
not falling off their growth chart. Um, that may be okay, right?
Mm-hmm.
But if they're not eating enough to the point that they're losing weight or not gaining and growing appropriately, it would be important to discuss, multivitamin versus some medication that stimulates appetite for the child. Like it would just depend on where the child is.
Yeah, that's great. That's great advice. Awesome. Okay. What about how can you tell if a child genuinely doesn't like something or they're just stuck in a routine of like the same foods? Like I just want, broccoli again, or I don't want, how can you tell that like they genuinely don't like it or they're just stuck in a rut?
Of genuinely don't like other foods, you mean? Or
Yeah, like if they don't like to eat other foods or if they're just stuck in their ways, like
no.
they're just eating the same things
Yeah.
all the time. Maybe they just need more variety.
I mean, you can, right, introduce the foods with that, say that food that they like for example, if they just like chicken as a protein, right, and they won't try anything else, maybe you continue to give the chicken, but maybe you put a little piece of beef, let's say, or turkey or whatever other protein you would like them to try. But and then you can also offer that food in different ways to try to get them to try like a different way to eat the chicken or a different way to eat whatever it is that they like. Let's say pancakes. They only want pancakes for breakfast. So maybe you want to start adding some fruit to the pancakes or adding some other protein, maybe, an egg and small peas, right? And try to expose them to other foods that they could have for that meal, but not taking away what it is that they like and will accept.
Yeah, that's great. So on that note, is it important to have a set meal schedule for picky eating? Like, is it helpful we know Wednesday is coming, broccoli night or whatever. Do you think that that's something that could be helpful or could that hinder, create anxiety? What do you
It
think?
could hinder creating anxiety because they know what's coming. I mean, it would be like In the ideal world, it would be, my recommendation would be to get them involved in the menu planning. If you do your shopping, let's say on Sunday for the week, and you're doing your meals that you're gonna cook or prepare for the rest of the week, maybe get them involved in like, what would you like this day? And obviously, like, you can guide them as to like, hey, we're not gonna have, let's say, chicken nuggets every night, right? So let's pick something else, and get them involved, and get them involved in the shopping, in the prepping of the meal. That could get them away from steer them away, right, from you rejecting what's being served.
That's good. That's great. All right, what about this? Is it normal? I think we've experienced this too. Is it normal for a kid to be obsessed with a certain food and then become tired of it? You know, how do you bring that one back in? How can we
I'm
improve that?
I'm guilty of that.
I do that too. I kind of get in a rut, where I'm like, I'm only eating this. It's easy and it's
Yeah.
here.
It's easy,
And then, yeah,
exactly.
then I burn out. So our kids can do the same.
Exactly. Let them, like I said, you can let them explore. And of course, if they're into one food and then they get tired of it, it's normal because you're eating that for so long, or so often. But it's also part of development. So it's giving them a little bit more autonomy when it comes to choosing, but also you guide them, right? You want them
Yeah,
to be able to eat a variety of foods.
that's great. All right, here's a specific question. How do you help a 1-year-old who refuses solids, only wants milk? They're like, I'm done with food. I just want milk.
Well, in that case, I would definitely try to get a speech therapist involved to see if there's any type of difficulty chewing. Sometimes they don't like chewing, or they get tired very easily. There's little things that could be done, and you can work with a speech therapist to assess the reason for them not wanting any solids, they don't want to chew anything.
That's great. Our audience is having great questions. I'm sitting here looking at all these awesome questions. So keep them coming. Rosia, you have so much expertise to share. So we're so grateful. All right, here's one. This listener says her daughter, 2.5 years old, likes every day scrambled eggs. Is it safe that they eat the same food? She said she adds fruits and carbs, but eggs is a must. What do you say about
That
that?
that's a great protein source. So yes, by all means.
I agree. I wish I've got a
Yeah.
kid who I have been trying for years to get her to eat eggs, and it's just we're struggling. So we just keep on. She's like, I hate the smell, and she tells the siblings, "Why do you want to eat that?" And I'm like, "No, that's not helpful." So we're
Yeah.
wrestling that. So way to go that your child is eating eggs. Here's another one. This lady says her son seems to be picky with colors. How can she help him try food with color, like veggies or yellow rice? She said he even gags, and she feels like it's more mental than anything.
It's just exposure and removing that pressure. Maybe the child is feeling pressure to try these foods, but it's just exposure without expecting anything, right? Just put it in a plate in a small amount and let them decide whether they want to taste it or touch it or not touch it. And repeated exposure will get them to be more comfortable with the food and trying
That's
that
so good.
food.
That's like a theme I keep hearing. Just
Yeah.
keep trying,
Yeah.
mama. Keep trying.
Just keep
And then
trying, but also we like I can't emphasize this enough. Is removing the stress factor from that
yeah, that's
from
good.
from the meal, from
That's
the
good.
food. Yeah.
Make it light. Just chill out. Chill
Mm-hmm.
out. I need to tell myself that about the eggs. Yeah, another attendee said scrambled eggs and protein yogurt are the only protein that her daughter will eat. What? That's good protein. Stay at it. Stay
Protein.
calm.
Yes.
And make it fun. Involve them. I love what you said about involving them in the process. Let them set the table. Let them stir the whatever you're making.
Exactly.
I think that is a great, great
Like
tip.
if you want them to eat veggies, that maybe involve them in the preparation. Do you buy them
Yeah, the
like a
little
child
chopping.
knife and little
Mhm.
chopping?
That's
They can
good.
help you in the preparation, like put the salt or whatever it is that you're using to season the veggie.
That's good. That's good. Yeah, I've seen all over Amazon little kid knives. And I mean, there is no power like a kid who gets to chop a vegetable. They feel
Exactly.
like they are really in charge. That is great. Okay, what should we do? Coach us through how to coach our children when we start a meal, because this is a frustration point. I think there's probably moms and dads listening, moms, especially if you made the meal and you set it on the table, you worked so hard, and your child goes, I don't even like that before they even try it. And it's like they're children, but it can be frustrating that you're like, I worked really hard on this. So
Yeah.
coach us through, like, what can we do if our children said, I don't even like that before even starting the meal?
So I would recommend like talking to them and explaining to them how much love you put into it and how much work you put into it. And then, to maybe choose something from the meal that is being served. So maybe they don't like the pasta, but maybe they like whatever else is on the side. And then, going from there. Um, Maybe
That's
serve
good.
them a little bit more of the side they like. Um, have them like, can tell them to try it. If they really refuse, then you let it be,
That's
right?
good.
But I wouldn't recommend that you go prepare them something else because then that's gonna be a
That was
recurring
my next
theme.
question,
Yeah.
was I was like, well, should you prepare them something else or then you become a sous chef? No, I'm not qualified for that. How about that?
Yeah.
Yeah,
But
that's good.
I mean, if they know how much work and love you put into it,
Yeah.
they will be more willing to try it.
Yeah.
And there's always something gonna be something they like, right? So maybe
Yeah,
go
that's
like choose that. Yeah.
That's great. All right, our audiences, they're feeling it now. These questions are popping up quick, so I'm going to put them before you. All right, one says, my 2-year-old eats pretty good, but being more selective lately. But he has been lately obsessed with bread and rice, and she's trying to substitute rice with quinoa. And then she said, what can I use to substitute the bread, or what bread do you recommend using? Do you have any advice on that?
Well, the bread, and then what about putting something on the bread?
Oh, yeah,
Like
that's good.
maybe,
Like some
yeah, like
protein,
changing
right?
it up, putting like if you're only putting butter, maybe doing a nut butter, like a peanut butter or almond butter, or
That's
some
good.
cheese or whatever else the child will accept. And then the rice, yes, and then adding other sources of protein, right? And adding like accompany the rice with something else, maybe they'll more willing to try some other foods. But again, in small amounts, so it's not overwhelming and
Good.
without pressure. Like just letting them decide how much they want to try and when they want to try.
That's great. All right, here's another one. My boys only want to eat dinosaur chicken nuggets, fries, pizza. Oh, not healthy at all. This are her words.
Mhm.
They're very particular about texture. They don't like meat or eggs or anything that is a significant source of protein. So, any other thoughts? I love what you said about bread, like putting some protein on the bread. Anything else?
Mhm. So in that case, yes, again, it's repeated exposure. We go
Yeah,
back to that, right? Repeated exposure to other foods. So maybe you put like the safe food, which will be the chicken nuggets, but maybe serve it with something else that will be
yeah,
new.
it's great.
And again, it's repeated exposure. Take them to the supermarket, take them shopping, have them
Hmm.
choose like which fruits would you like to have this week? Which veggies would you like to have this week?
That's
Um,
good. What do you suggest too? I'm going off the rule here, but of just like hidden veggies in recipes. Like I do a spaghetti, but sometimes I'll put carrots in there. I don't know if that's even helping, but like hiding veggies in your sauces or stuff like that. Is that a good way to get
I mean, you can
vegetables or not
hide it,
really?
but not hiding from them, because
Right.
then they could feel, yeah,
Yeah. Like you're sneaking on me, mom.
yeah.
Okay, maybe not the best idea. All right, here's another one. A mom says her daughter prefers veggie and fruit, no meat. And she said, how can I help her get more protein? She's a self-driven, unofficial vegetarian.
Can you repeat the question? I'm sorry.
Yes. So this
It-
mom, her daughter is just eating fruit and vegetable, not a lot, no
Mhm.
meat. And so she's wondering how she can get her more protein.
Well, depending on the age of the child, I would say you can do like uh protein powders. You can do tofu, which is a great
Okay.
source of protein if they
Okay.
won't eat any meat, right? You can do like sources like beans and lentils and
Okay.
chickpeas to add
Great. Oh,
protein.
yeah, that's good. Even like a
Yogurt.
hummus, is the hummus good
The
source with the
hummus, the
chickpeas?
hummus has a little bit of protein, is more of healthy fat, but it's
Okay.
good also. And
Okay.
then, but the chickpeas will have a little bit more protein. If this, I mean the chickpeas, the beans will have a little bit of protein. Lentils have
Yeah.
they're a good source of protein.
Okay.
And like the tofu, so other vegetarian sources of protein.
Great.
And even
Great.
a protein,
Awesome.
like a high protein yogurt or a protein powder if the child is old enough.
Okay. Okay. Is there a certain, what age would you say on the protein powder there?
Like 12 and above.
Okay. Okay. Good. Great. This is so helpful. Great questions, everyone. All right, we've got more. All right, here's a general one, how to get your child interested in food. You touched on that a little bit. I'm sure that depends on the age as well, but maybe just some overarching recap on that. How to get your child interested in food.
In food, well, it's actually part of the development, right? So you have to start looking at their cues when they're ready for food and for certain and for the change in textures. And it's just it's basically working with your child to see what they'll accept when they're ready to move on to different textures once they turn 6 months old, and then introducing foods, not necessarily like the way that we've been taught to introduce food, which is always like start with the veggies, start with this. You can start with whatever food you want, and there's also been research that when you introduce them to proteins early on, they'll be more likely to like the proteins versus, because we tend to feed babies only veggies for like the first week, right? And then we introduce another veggie, and then we don't want to introduce the fruit later on because we say like, oh, if they like the sweets, they're not going to want anything else. And that's not the case. They could be very willing to try different foods early on. It's
That's
just
good.
exposure and patience, and also knowing that, of course, they're going to have taste buds, so there are going to be certain things that they're going to like versus things that they're not going to like.
That's great. That's good. Yeah, it's easy to think, oh, she's never going to eat anything after eating a banana. It's too
Yeah.
good. Okay, here, this parent says they have a 4-year-old child that only drinks water, will not drink milk. How necessary is it to have them drink milk for their proper growth and development? Or can the lack of milk be supplemented another way, like yogurt or cheese?
Exactly. You have other sources of calcium, and there's spinach as well if the child likes spinach, besides the dairy products. Like they don't have to necessarily drink milk, but they could have another type of milk that is fortified with calcium, like there's almond milk or soy milk,
That's
right?
great. Yeah, yeah, great
There's
sources.
other type of dairy products that they could have, especially, I mean, we deal with a lot of milk allergies. So there's
Mhm.
other milks that are fortified with calcium, and there's foods like the beans, the legumes have calcium, spinach has calcium, so there's other foods that have calcium.
Okay, great. I never would have thought spinach with calcium, but that's great.
Hmm.
Learning so much. Okay, another one says her daughter doesn't eat protein. She's 3 years old, only pasta with basil. So just keep introducing, right? Or maybe add some protein in that pasta. Like, could
In that
you,
pasta,
you know?
exactly.
Okay, great. Dice up some chicken real fine, maybe.
Mhm.
All right, here's another one. Are there any resources that you know of that can help with ideas on how to make food fun or how to prepare the food in a fun way or serve it in a fun way?
So I know at the end of the presentation we have some resources
Great. Yes.
that yeah,
Yeah,
for
hang
that
with us till
people
the
can,
end. I'll tell that
yeah.
viewer, like, hang with us. You can screenshot. And there's just so many great ideas on Instagram. I will say it can be overwhelming. So don't put pressure on yourselves, mama. I've seen bluey toast where moms make toast to look like bluey. And if you've got the bandwidth and the time, go for it. But don't feel like you're not a good mama if you can't make your toast look like a
Yeah,
cartoon.
some of them are
Um,
very overwhelmingly like elaborate.
yeah, right. I'm like, oh, sometimes I put the banana in a, like an arch. That's like about as
I
creative as I
think
get.
like we can even make it fun with using the cookie cutters, right?
Yeah.
Or
Oh,
like
for
sandwiches or
sure.
fruit and things like that. Yeah.
That's right. That's right.
Mhm.
Oh, I love it. Or, put it all in the shape and make a face on the plate. You eat the
Yeah.
eyes, eat your 2 oranges so that you have that, whatever, make it
Yeah.
a game. Okay. Another guest says, how can I make rice and pasta more fortified in protein? Is it useful to cook it in bone broth? Good question.
Definitely. That's a really good idea.
That
Mm-hmm.
is a good idea. Wow.
Mm-hmm.
Yeah, I hadn't thought about that.
Yeah.
Great job, Meredith. Thanks for the question. Okay, let's see. Here's another one. We just started giving egg to our 16-month-old because we're thinking that he has an allergy, maybe after throwing up a couple times after having it. So, what is the best way to give it to him since he started to, you know, I guess throw up the egg now? I hope I understood that question right.
No, yeah, I'm not understanding. So
I
they
think they
fed
just
him.
started giving, he was allergic. So I think he threw up a couple times after having the egg. And so they're realizing, like, oh, we're still trying to give it to him and introduce. So what's the best way to do that if maybe he threw up after having it? Maybe he does have an allergen. I don't know.
Could have an allergy, so I would wait because sometimes they outgrow allergies. So I would wait some time before reintroducing and see how he tolerates it. I think it's a
Great. Isn't this so awesome, audience, that you can ask your specific questions to an expert? You're not having to go in and have an appointment, but you can have an appointment if you wanted to go further. But isn't this wonderful to be able to ask our questions? So here's another one. 4-year-old refuses to eat anything other than fish sticks, pizza, perfectly round popcorn chicken, or dinosaur-shaped chicken nuggets. Says he loves snacks, chips, and pretzels. He does not accept other foods like hot dogs or burgers. Do we have to introduce foods that we want him to eat and have them eat that or nothing at all? I guess they're saying like, yeah, should you just remove all that and then go all new or
Yeah.
what should they do?
So we've already discussed that, right? So it's not about removing what they like, it's about serving what they like with something new that and allow them to try some different foods.
That's great. Yeah. And you've given us lots of good ideas with the beans, legumes, and sneaking in those
Mm-hmm.
vegetables. Love it. So great. Wonderful questions, audience. Keep them coming. All right, here's another one. What if our child snacks all day and won't eat a full meal? What should we do?
Well, as long as I would say make sure that they're eating balanced with the snacking, right? There's not just snacks like chips, let's say. Like maybe you can have like cut up like veggies and hummus or bean dip or some chips with bean dip, and you have some fruit. You can have some nut butter add to it. Different snacks. Definitely, it's not going to be um, the sole source of nutrition,
Yeah.
but it also like watch to see how many snacks or how much the child is eating, because maybe they're having so many snacks that it's actually taken away from their hunger from the
Yeah.
meal, right?
That's good. That's good. Is there a good rhythm for that of like, okay, you have a meal, you have lunch at noon, like, and then should you no snacks till, I don't know, every child's different and you're not like on a timeline because no one wants to eat on a
Mhm.
timeline, but is there a kind of an ebb and flow that you would suggest for
But
snacking?
if yeah, so if the child had a meal and they're requesting a snack like right after the meal, I would just assess like, hey, did you eat enough or did you not eat
Yeah.
enough? And that's why you're requesting the snack.
Right.
And then if the snack is too close to the meal, I would just tell them to wait, the meal's coming so that they're
Yeah.
not full by the time the meal comes, and then, they end up eating only snacks.
Yeah. Yeah. That's great. That's great. Okay, here's a couple questions from our audience. All right, what vitamins do you recommend? That's kind of broad because I would assume it would, you know, vary based on child and needs and whatnot. But is there anything kind of overarching that you would say there?
But meaning like brands of vitamins or
Yeah, I mean, she just
yeah.
said vitamins. So maybe is there like certain supplements or maybe, yeah, if you have certain brands that you feel like are better or most kid, you like you're seeing, oh, maybe, some people do gummy vitamins or they do the multivitamin.
Yeah.
Like, is that necessary for every child? Is that something that you should,
I
you know,
mean, I always recommend like a good multivitamin.
yeah,
It's not gonna hurt them, and a lot of times because we have such picky eaters or kids that are only accepting a certain food group, I
right.
would recommend like a good multivitamin.
Okay.
Um,
That's
yeah.
good. That's good. All right. Is there any advice on how to balance a picky eater with fiber intake and constipation? Because if they're eating, some of the same things, it could be causing problems.
Exactly. So making sure they stay hydrated as well, they're drinking enough water.
Water.
And
That's good.
again, like if that's the case, that maybe, sometimes they won't eat a fruit, but maybe they'll drink like a smoothie. So you
Yeah.
can make them a smoothie with some fruit
Yeah.
and you can even add some fiber to it.
That's good.
Um,
That's good. Yeah. Oh, good. We love to put, I let the kids when we make smoothies, we put all the vegetables, whatever, or all the fruits. And then at the end, we put in a huge handful of spinach. And I'm like, let's make it green, and they think it's fun because it
yeah,
turns it green. But I'm like,
yeah,
you're eating spinach. I think this is a
exactly.
win. Yeah, we try to
Yeah.
sneak it in there. Okay, here's one. How do you manage junk food as it's sometimes offered when the parents are not in control? And where does it not, let's see, where it does not become the food that they only want to eat moving forward? Yeah, just I guess managing junk food when you're not there to help them make good choices.
But if it's, yeah, it usually, I mean, if it's not like a common at the home, right? So if
Hmm.
it's not a common food that is going to be served at the home, they shouldn't be just geared towards that type of food group, right?
Hmm.
Or food choice, I want to say, not
Yeah,
food group, but food
yeah.
choice. So
Uh-huh.
it would depend. Like if we're always offering fast food or processed foods, that's what's gonna be like what they go towards, right? But if it's like a
Right.
once in a while thing, like let's say the grandparents are taking care of the kids and they take them to McDonald's or whatever, like that's
Right.
not their comment. That's not what they do every day at home, and that's okay.
Yeah. Yeah. No, that's good. Something that we do with candy specifically, because I'm finding they're getting candy for going here and doing that, or a reward of candy or whatever. and maybe this is a bad idea, so correct me, dietitian, on this, but what we've started to do is we have a little adventure jar. We call it the wow jar or whatever. But the kids know they can bring the candy, put it in the jar, and when we fill the jar, we cash it in and we go, to the bounce place or to the, some fun activity that they're excited to
Mhm.
like go do. I'm like, is this setting them up for bad patterns? But in my mind, I'm just helping them make a choice to choose something better. Like, oh, I don't want that. I want to instead, and of course they can have a snack, but I don't know. Is that a good idea or is that, I don't know. I'm asking if
No,
that's
if
like,
if it's working for your child, by all means. If they're really adamant about having a piece of candy, just include the piece of candy as part of their meal, so
yeah,
that we remove that bad food connotation.
yep,
Because
that's
remember,
right.
whatever we get prohibited or
Ah, you're like, I think I want more of that.
I want more, yeah,
Yeah, that's good.
exactly.
That's
So
good. You're right.
removing that bad food, because we don't want to label foods good
As
versus
bad.
bad.
Yeah, that's
So
good.
it's okay to have a piece of candy. If they really want a piece of candy, just let them have a piece of candy, put it as
Yeah.
part of their meal.
Yeah. That's good. That's great. Awesome. All right. Here's another attendee question. If their child doesn't want to eat the food that he wants and refuses the food you're giving him, should you take away all food and repeat until they start eating? What should you do there? They're
No,
just
just
refusing to eat, it sounds like. Yeah.
refusing to eat like anything.
Yeah. It says they don't want to eat the food that they want and they don't want to eat the food that you're giving them. Should you just be like, okay, no food. And when you're ready to eat, you'll stop acting like that.
Well, there's always going to be something that they like, I'm assuming, right?
Yeah.
In the meal that is being served. So let them have the like choose something from whatever's being served.
Yeah. Yeah. Okay. This was one kind of like we had, but the child's a little bit older. Let's see, a 3-year-old has regressed to wanting milk over food. Any advice to bring them back to eating?
Yeah, especially if they're 3 years old, you don't want them drinking milk only, because that could also it could also make them anemic, actually.
Oh, okay.
So
Okay.
you want to try to, at that point, I would say get an assessment, like discuss with your pediatrician, see if it's warranted to see a speech therapist to see what's going on and why the child is no longer wanting or accepting solids
Okay.
and just wanting the milk.
That's great. Okay, good advice. All right, here's one. This mom says some vitamin brands are talking about the hidden hungry related with missing vitamins in our children's body. Is that true, or are they just trying to sell vitamins? Have
The
you heard
hidden,
anything about that? Like
I'm not
hidden
understanding the
hungry?
question.
That yeah, she said that vitamin brands are talking about hidden hungry, which is more related to children who are missing certain vitamins in their body. Like, is that true, or are they just trying to sell more vitamins? It's a good question.
Yeah, no, I'm not understanding the question. If it's true that there's hidden hunger,
Yeah, like I don't know, maybe they're yeah, it sounds like a good marketing scheme.
yeah,
I don't
no,
know. I'm not yeah, that's I'm not sure
yeah.
about that one. Maybe it's a something it sounds like a tagline that maybe a brand is using to
Yeah,
say
and I haven't
you
seen
should
it,
buy
so I don't think
vitamins
that
because your
understand it.
child is
Yeah.
hungry and you don't even know it because they
Yeah, yeah,
need
yeah.
certain vitamins,
Because they're lacking vitamins.
Yeah,
I
yeah.
don't think I mean, certain deficiencies are gonna cause you to go towards foods or non-food items, which we
Uh-huh.
see also in malnutrition, right? When they're
Yeah.
lacking certain foods, sometimes certain nutrients, they'll go for non-foods like chalk, things like that, than
Yeah,
just
right.
something else.
Interesting. Yeah, yeah, yeah.
Uh,
Yeah.
but yeah, but if it they're not, normally I recommend a multivitamin, especially if the kid isn't eating, like, isn't like one of those kids that will eat all food groups. Like a good
Mm-hmm.
multivitamin is not gonna hurt.
Yeah.
Um, but definitely, yeah, like I don't think like everyone needs a vitamin.
Yeah. Okay. Is there a way to like test of where our children's levels are of what vitamins they need or don't need? Is that something you do with your pediatrician or a dietitian?
Yeah, with your pediatrician, it will be
Okay.
blood work.
Blood work.
Yeah.
Okay. Okay.
Mm-hmm.
Yeah, you just ask your pediatrician. Great.
Yeah.
All right. Here's a good question because this can also affect potty training. Talking about constipation, what food can we add to the diet of a 2-year-old? She has a really hard time with bowel movements.
Yeah, so we could do probiotics
Okay.
to help. Also, if the child is not eating a lot of fruits, and also hydration, make sure they're drinking enough
A lot
fluid.
of water. That's good. Okay.
So it's fiber, but also hydration, water, and then probiotics. You can also help them with like things like prune juice could also help
Oh, that's
with
good.
the bowel movements because very difficult that they'll eat the actual prune. But for a
Yeah.
baby, a 2-year-old, I would give prune juice.
Some juice. Okay, great. Thank you. All right, great questions from our audience. I'm watching our time. We have about 10 more minutes. Might finish up a smidge before 1. So if you have those questions, keep them coming in our Q&A box for Rocio. All right. 16-year-old daughter has autism and has been a very picky eater all of her life. In addition to eating, she's drinking protein shakes and taking a multivitamin with extra iron. Will she be a picky eater for the rest of her life? And what suggestions can you offer so we can expand her palate?
Yeah, but with a child with autism, I would get help from a professional, like work with a speech therapist, because a lot of times it has to do with the textures
That's great. That's great.
they're
All
willing
right.
to accept. Yeah.
Awesome. Yeah. Okay. At what age do you recommend toddlers stop drinking formula such as Pediasure?
Well, what do you mean?
I don't know.
The
So formula like
supplementing they could drink.
Pediasure, maybe it's like a little drink, like a supplement
Yeah,
drink. Is there a
but I
certain
would
age
only
you
give
recommend?
Pediasure if yeah, I would only supplement Pediasure for children that are not eating for whatever
Okay.
reason that is temporary. I wouldn't recommend that as a supplement to be given daily.
Okay. That's helpful. Great, great,
Yeah.
great, great. All right, what about if kids are eating a lot of carbs but not interested in protein and vegetables? Is that okay? I mean, I have a little girl who would eat butter noodles for the rest of her days, but we are working on it. So what would you say once you want a lot of carbs, not as interested in the protein and vegetables?
But it's about, again, serving them, right? You got to serve them and expose them to them.
That's great. Yes, I think we're all
And
walking away with that encouragement to stay the course. Don't give up. Keep introducing those good, healthy foods and just no pressure to chill out
mhm.
and offer them to our children. That's good. All right. Same, a similar thing. Our children ask for the same breakfast. You know, for example, what can we do? Like they want oatmeal, they want oatmeal, they want oatmeal, they want oatmeal. What would you
But the
suggest?
And again, the oatmeal is also a great source of carbohydrates, which you're going to need if they're going to school, or even if they're little and they start walking and running, they're going to need their
Yeah,
carbohydrate, right? It's good for brain health and for
that's
brain
right.
function. My God, like
Yeah,
everybody's so into like not carbs or not
right.
giving enough carbs, and we need them for brain function.
That's good. Oh,
So
yeah.
um, again, introducing different foods along with the oatmeal. So maybe some fruits, maybe the egg, maybe a small amount of egg,
Mm,
maybe like some turkey or or a slice of bread with some nut butter.
that's
But
good.
it's a small piece along with the oatmeal, not removing the oatmeal.
Yeah.
And then also it could also be cycles and that they go through like one in oatmeal and then they get over it and then they want to try something else.
That's right. That's right. One thing I found, and correct me if I'm wrong on this, but finding out literally, I mean, like what you said about the calcium and spinach, like, oh, I had no idea. But I've learned like, okay, strawberries and tomatoes are good for your heart. You know, I tell my children, hey, these great red foods are good for our heart and they're gonna make our heart strong. And then I find they remember that and they'll say, oh, look, I ate all these. They're so good for my heart. But I wonder if making those, even some of those healthy connections in a non-pressure way, maybe
Mhm.
excites them in some ways that they're fueling up, you
I
know?
mean, depending on the
Yeah.
child's age, sometimes they can make that connection and sometimes they don't.
Yeah.
So
Yeah.
they may just be repeating that it's good for their heart, but they're not really
Yeah.
connecting what it's doing for their heart
Okay. Yeah.
or why they need a healthy heart.
Right, right.
It's just repeating what they're hearing.
Yeah,
So I know that we do it for ourselves to try to get them to try foods, but a lot of
yeah.
times they're not making that connection just yet
Okay.
because they're
That's good.
young. Yeah.
Yeah, 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 yeah. That's good. Awesome. All right. At what point should we worry if our child's diet is very limited?
I would say if you see the child not growing and gaining weight appropriately,
Yeah.
if you see that your child is falling off or like you haven't changed the shoe size in a
Oh, yeah.
while or the size in clothing, or you go to the pediatrician and you see like they're not gaining weight, they're not growing, they're falling off their growth chart.
Yeah.
I
That's
mean, you
good.
don't want them to fall off the growth chart because that's when you go, that's like
Yeah.
a little extreme, right? We want to
Yeah.
take care of it before. But if you see them that they're not growing or gaining weight, then it warrants a visit to the pediatrician. to
Yeah.
assess where they're at. And like I said before, not every child needs to be on the 50th percentile, but they should be on their own growth chart and not falling off the growth chart.
That's good. That's good. Which is why staying up to date on those pediatrician appointments, those well visits is so important too, to see that, because we can't always see that or track that so well at home. So that is really good and helpful. All right. At what point should we seek additional help for our child's picky eating? Like maybe when should we visit or make an appointment with a dietitian or speech path?
I mean, when you see like they're not open to anything, or again, they have those feeding aversions that are so severe, right? They're not willing to try anything at all. It
Yeah.
would warrant a visit, an assessment by a speech therapist, and see what's going on with the
Yeah.
dietitian, because we work together very much
Hmm.
so with feeding aversions.
That's great.
Um, and they can give you guidelines as to what or when to introduce different foods and textures.
Amazing.
But
Wonderful.
again, you don't want to wait until the
An
child
issue.
is not growing, right?
Right, right. Yeah, staying proactive on that. That's great. Here's one
Mhm.
more question I saw in our chat. 3-year-old son primarily only drinks water, very active, constantly drinking water. His teacher even said that she's expressed concern of him drinking too much water. How much water should a 3-year-old drink without having concern?
But why is there a concern that the child is drinking too much water? Is he getting dehydrated? Do you feel, I mean,
Yeah, I don't know.
I don't know.
Say that for the
I
moment.
mean, we
But
have
just
some
in general,
guidelines as
drinking
to,
water is fine, right?
yeah, should be
A
fine. I
3-year-old's
guess,
not gonna
you
like
know, you know,
overdose water.
yeah, so we can also look at the urine. We don't want the urine completely clear, right? It
Yeah.
has to has
Okay.
a, because then if not, they're like overhydrating.
Oh, okay.
You want to make sure that it has a little bit of color, should be light yellow.
Okay. That's great. That's
And
good
then go
advice.
from there to see like why is it because he's running outside and sweating so much and he wants water. But at that
Mm-hmm.
point, I would also recommend like maybe mixing it with Pedialyte or something like that to give him some electrolytes, and so that
Okay.
he's not over diluting his electrolytes. But
Okay. Yeah,
it
that's
would
good.
require, yeah, more of an assessment to see what's going on.
Okay. Okay. That's great. That's helpful. Thank you. I'm going to close this out with this question. We've talked a lot about, watching that growth chart and seeing if your child is underweight, like you want to kind of raise a red flag. Is there ever a point where you might say if your child is a little overweight? We received a question of a parent said their child is a little overweight. Like, what advice would you have for altering a diet if your child were a little bit overweight?
So it depends on how overweight the child is, because we have to be very careful with that, right? We don't want to push towards an eating disorder later on.
Right.
Um,
Yeah.
we should not be focusing on weight, depending on the child's age. We should not be focusing so much on weight, and as much as in providing balanced meals with the right amount of food, like the right portions, right?
Yeah. That's good.
Because at the end of the day, I know that sometimes I've had parents that tell me, no, but I can control what they eat in school. Like, I understand that, but it's about educating them about like, you know, what you're serving at home, what you're doing for them, and exposing them to other foods, other like
Good choices.
better
Yeah.
choices. We want to say that.
Yeah. That's great. Oh, Rusia, thank you so much. You are truly an expert, and I feel like we just skimmed the surface of your expertise. We could go on for days, I feel like. Hopefully, we can do a part two of this and go even deeper
Yes.
because this is just great information. It's stuff that we need as parents, not only for our children, but for ourselves. And I think one of the things that you kept saying that really resonates, and I'm going to walk away with, is like our kids are watching us and they're watching what I'm eating and the choices that I'm making. And I don't have to pressurize them to make good choices. I can model that and I can open and invite them into that by offering them good, healthy choices. So thank you so much for spending time with us today. We're so grateful. I'm going to draw your
Thank you so
attention.
much.
Yes,
Yes.
go ahead. I'm sorry.
No, no, thank you so much. It was my pleasure being here. I loved it.
Of course, of
Speaking with
course.
parents.
Now, we someone asked about resources. If you want to screenshot this, these are great resources that you can follow. There's a podcast, Instagram, and some other resources there as well. Some books to help you dive into this a little deeper for study on your own. I also want to draw to your attention that Thursday, February 20th, the third Thursday of February, that's going to be the 20th at noon. We'll be back again for our episode about heart health across childhood stages. So February is the heart month, the love month, but let's talk about our hearts and for our children's even. So heart health across the childhood stages. Join us for that. That will be February 20th at noon. And as a reminder, all of our parental guidance webinars are available for you to download. You've got tips and resources there at the new website, which is parentalguidance.org. So check that out. You can also sign up for future episodes there. So we will have this in the archives. Just give us a week or so and you can forward it on to a spouse or a friend. But thank you again for joining us. Rosia, thank you so much for your expertise. We appreciate you.
Thank you.